Hey, I'm KRUPA George, and I wanted to hop on and introduce myself to the community. I thought it would be helpful if you could get to know me and a little bit about my practice before you come to see me. So, I was born in England and I was raised there. And about when I was 13 years old, me and my family moved to Texas, like most immigrants do in search for the American dream. So as a Texan, of course, I went to the best school in Texas, Texas A&M University, and I got a degree in biology. And then I went to UT in San Antonio for dental school for 4 years. And since then, I have been practicing in Houston for about 5 years now. And now I am the proud owner of Pure Holistic Dental in Sugarland. Um, and I think the most important thing I need to explain first is what holistic dentistry really is, because a lot of people think it's about yoga and crystals, and really holistic is nothing about that. What it really means is that we consider the whole body, mind, and spirit. And really, that's the philosophy that the mouth has a huge impact on your overall health. Um, and oh, holistic also, it goes by these other names. The most scientifically correct name is biological. So it's biological dentist, or it can be natural dentist. There's a couple different names. It could be functional or alternative dentistry. It's almost the same thing. Just have to figure out what that dentist's philosophy really is. Um, Now, why did I go down this path? Well, I think I have to be really honest and say that holistic, I was not always holistic, right? I didn't always believe in it, and I was not taught that way in school. Um, I was barely taught about any connection between the mouth and body in school. So it was just really my own research and findings that got me into it. I first started, it was only after I got my doctorate that I started learning about the connection between even gum disease and heart attack and stroke. And then I kept going down the rabbit hole of reading and attending courses to learn more about this. And I found that there is a huge connection and about all these toxic materials that most dentists use, right? So, you know what really drove me going down this path was that my patients kept coming back with more and more problems in their mouth. It was like I would fix a cavity, and then 6 months later, they'd come back and they would have more cavities. And I felt like I was just wasting their money, I was wasting their time, because a true doctor, I felt like we were supposed to prevent problems from happening. And I didn't feel like I was doing that. So I really wanted to make a bigger impact. And that's why I created Pure Holistic Dentistry in Sugarland. So let me tell you a little bit about the toxins I found. I pretty much figured out that a lot of things that we do in dentistry is toxic to the body, including fluoride treatments, the process of drilling out mercury fillings, that the fillings even contain BPA. So, you know, there's also metal in the mouth, and even root canals are so bad for you. And I chose to use only the most compatible materials in the office. Yeah, nothing containing fluoride and nothing with harsh chemicals. Even before the spread of the virus, we actually have the whole setup already for removing toxic materials. I already have HEPA filters in the office. Our patients are given an oxygen supply in their nose so they can breathe, and they're fully covered, with draping. And this avoids contamination and their inhalation of toxins. We actually test patients for compatibility of materials that we put in their mouth. We use a blood test to see which antibodies are interacting with the materials in the antigens before it happens in their mouth and in their body. So let me tell you a little bit about our assessment process in the office first. Okay, we do a whole body assessment. We we start with the airway because the modern diet and lifestyle has really made it hard for a lot of people to grow properly. Now let me explain what I mean by this. I was looking at this study in particular. This is from Dr. Weston Price, and he followed two different populations who ate their native diet made up of one which ate their native diet. You know, they ate these whole foods, anything they could hunt, without the use of antibiotics, manufacturing, and pesticides. These guys didn't have dentists like we do here. They didn't have toothbrushes and toothpastes. Um, and then he compared this population to a similar group in this similar area, but they had a more Western. And this second group, they were the South Sea Islanders. They had a Western diet consisting of processed foods, what we call junk foods now. They had refined sugars, they had white flour, sugar made of jams, you know, they had marmalades, canned food, baby foods. And so these guys actually did have toothbrushes and toothpaste to clean their teeth with, and then he compared their dental health. And let me tell you, I want you to guess which one is which before yeah, which do you think is the modern diet population here, and which one do you think is the more primitive group eating indigenous food but no access to healthcare? And yep, actually, this group here is the group that had the modern diet consisting of processed foods. Just crazy how much decay they have in their teeth. And this group over here, and this group over here, they didn't have any sugars, refined sugars, no processed foods, remember, and they didn't have cavities. It's crazy because they didn't have toothbrushes or toothpaste, but the food they had was just nutritious enough to prevent cavities in the first place. So you can see that the primitive islanders didn't have decay. In fact, they had straight teeth, their bones grew properly, they had a wide mouth, and proper facial features like their cheekbones. Their Western diet really didn't. We see that the Western diet here causes impaired mouth. It leads back generations, not just to what you eat, but it leads back to what your mom ate and what your grandma eats, because it's epigenetics. And that is why I look at airway first, because there is such a high risk for having a normal airway. What I mean by a narrowed airway, it's high chance that they're going to have a narrowed airway. So that's why we take photographs, we look at symmetry, posture, we even take 3D x-rays, it's called a cone beam, to see the space in the airway. And if you look at this lady over here on the left, you can see the convexity in her face. It's nice, she's well developed, her airway is nice, it's all white on the scale. The white is the best, and red would mean that she has a narrowed airway. So very good features here. If I'm looking for impaired mouth and looking at the features there, there's a couple of different ones over here, and we can talk about that, you know, but there's signs and improper development that have been seen to show. And we typically see this type of narrowing right here in our patients, and even the symptoms line up, you know, because symptoms of reduced oxygen to the brain are so common in our patients with upper airway respiratory syndrome. And if you're going to go through this, and you have a narrowed airway, oh my gosh, they're going to match up, because heart disease, obesity, you know, someone that feels tired, depressed, restless leg syndrome, a lot of these are connected. They're connected to a reduced amount of oxygen going to the brain. I mean, if you have these signs, start thinking about what might have caused the root cause for it. And it can usually will lead back to oxygen deprivation going to the brain. Look at this boy over here. He has a crooked smile. His teeth are not aligned. He doesn't have enough space in his mouth for all his teeth. Doesn't mean that his teeth are too big, just means his jaw was not developed properly, you know? And you might also see that you have these notches on your tongue. That's a big sign that you have a reduced airway. It's just to do with where your tongue rests, where it should be resting at the top of your mouth and not on the bottom, causing there to be notches right here like that. Or if you have notches even on your teeth next to your gum line, that's a sign that you're clenching or grinding your teeth, and that's typically to do with a reduced airway. Now, okay, Doc, you're probably thinking, how in the world are we going to fix this, right? So there is a solution. There's not just a one solution for everyone. It's all individualized. And there's a couple of different things that we can even start working on right now. If you want to learn about these different techniques and you want to know how you can start doing them at home, please comment in the video and like on my video and share it with your friends that you think that can benefit from these things. Thanks again for watching. Let me know what you'd like to hear about next.